Opportunities for Ohioans with Disabilities is presenting Introducing Startup, set up for Technology Access Readiness Training. Thanks for joining us today. This is Jay Burns with the Provider and Contract Management Unit. I'm also joined by Ginger Scaife and Jennifer Pollard. Today, we're going to be discussing why we're adding an important new service for Ohioans with Disabilities. We're going to talk to you all about startup, the objectives of startup, the details of this new service. We're going to tell you where you can get the billing and report form. We're going to differentiate what parts of this service are offered in person versus remote delivery, the location of the service delivery. We're going to talk a little bit about how startup is different than rehabilitation technology as a service, the required provider credentials. We're going to talk about requesting the service in the Provider Management Portal, or PMP. We're going to talk about comparable benefits when working with our individuals. We're going to give some examples of the startup services, and we're going to tell you some next steps in delivering this service. A new service, startup. Since the pandemic, we've been using more and more remote services. It's likely that we will have remote services continue in some capacity. OOD as an agency, its counselors can purchase iPads, data plans, and other technology for participants. Some students and individuals with disabilities already have technology at home, but some people need help after getting that physical hardware, actually connecting online and engaging in remote services. As these individuals use this technology more for remote services, we need to make sure that they are able to utilize this equipment really fully and to the best of their ability. This includes unboxing the equipment, turning it on, setting it up, getting it connected to the internet, being familiar with the technology, and being able to access remote services safely and securely and confidently. That's where startup comes in, to close the gap and help participants get to the next step.
This is Ginger, and our startup objectives. The provider staff will work with participants to familiarize themselves with their available technology to be able to assist in a setting up a user account, such as an Apple ID, and or a professional email address if necessary. How to connect to wireless options such as Wi-Fi, a mobile hotspot, mobile data, or home internet. To teach individuals how to utilize devices and access applications/programs required for remote services such as Zoom, Microsoft Teams, or Google Meetings. How to participate in remote meetings, including using the camera in terms of backgrounds, the mute, unmute functions, closed captioning, and other appropriate remote service etiquettes such as clothing, language, and behavior, along with discussion of online safety, such as not sharing personal information, pictures, social security numbers, and the like.
Hi, this is Jennifer. The next topic is details of startup. In most cases, 2 hours of startup would be suitable to allow a participant to achieve the service outcomes of getting initial familiarity with technology. Startup shall be authorized for up to 20 units of service initially, which shall include the initial setup and training as well as a follow-up meeting. A provider may request an additional 20 units of service in writing by outlining what still needs to be addressed, planned interventions, and potential issues or barriers. VR staff will then review and approve the request for additional time as appropriate and based on individual needs. This generally will not go beyond a total of 40 units of service and must be documented and aware by the VRC. The startup service matches the units of service for on-the-job supports at $6.40 per unit of service or 6-minute increments. Therefore, an hour of service would be $64. Startup is an individualized service. Intake shall not be authorized for this service alone, but an intake may be authorized in conjunction with a qualifying service that the startup service is supporting, such as career exploration.
Details of startup. Once a participant receives startup services and is successfully able to engage in remote services, they would move on to another service, such as remote career exploration, remote pre-ets, and so on. If a participant has a need to further enhance their computer skills beyond startup, they should discuss further options with their counselor or coordinator. Startup can be utilized to help a participant set up their technology and be ready to engage in virtual hiring events. Job development or job seeking skills training may assist with the preparation for the actual hiring event in terms of developing an elevator speech, being ready for interview questions, and so on.
Startup form. A new simple report will be developed and will capture that the objectives have been met, along with additional areas for any notes specific to the individual. The startup form will be available on the OOD website under Information for Providers, Provider Resources, and then check on Provider Forms.
Startup, in-person versus remote delivery. The initial startup meeting for setup and training would generally be in person. It may be provided remotely with VR staff approval. The objective of the startup service is to assist individuals who do not have the basic computer skills to access remote technology to engage in services such as utilizing an iPad, laptop, or PC with a program such as Google Classroom, Microsoft Teams, Zoom, and so on. If a participant is able to engage in receiving remote services, they would not require the startup service. The provider shall follow up to at least 5 days after the initial setup/training to ensure that the person is able to successfully participate in a remote service or meeting, such as Teams or Zoom, independently. This contact should generally be provided remotely to verify that the participant has the ability to meet remotely, but may also be provided in person with the permission of the referring VR staff.
Startup, location of service delivery. Generally, OOD services are provided outside of participants' home, with the exception of a few services such as activities of daily living, which is where a participant is taught how to potentially cook or iron in their home. The startup service can be provided in a participant's home if all of the below conditions are met. Provider offices and community meeting locations have been explored and cannot be accessed. Counselor has given written approval for the participant to receive services in-home. Participant is comfortable and is given consent to receive the service in-home. Services will be provided in the general living space of the home, including living room and kitchen, and are prohibited from being provided in personal quarters or bedrooms. Minors have parent/guardian present for any in-home service, and provider and participant agree to follow current Ohio Department of Health guidelines, including wearing a mask or social distancing requirements.
Startup versus rehabilitation technology. Startup is a general service to get individuals started with a basic technology functions in order to be able to get them to engage in remote services. Rehabilitation technology is a specialized service that provides a systemic application of technologies, engineering methodologies, or scientific principles to meet the needs of and address the barriers confronted by participants with disabilities in the areas that include education, rehabilitation, employment, transportation, and independent living. Rehabilitation technology services are generally provided by providers with credentials such as the Association for the Education and Rehabilitation of the Blind and Visually Impaired, AER, or the Academy for the Certification of Vision Rehabilitation and Education Professionals, ACVREP. These certifications are not required to provide the startup service to individuals without a vision impairment. For example, if Mason is getting an iPad but does not know how to use it to turn it on, access the internet, or to utilize Microsoft Teams to engage in pre-ed services, the startup service would be authorized in advance of the pre-ed service so that Mason can be ready to engage in those services remotely. Another example is when Emily, a participant who is blind, needs rehabilitation technology learning in order to utilize JAWS software. She would require a rehabilitation technology service.
Provider requirements for startup. Approved providers who currently offer core services such as job development or pre-employment transition services or rehabilitation technology credentialed may apply to provide startup services. The startup service is typically authorized in conjunction with a service, such as pre-eds or career exploration, that is being delivered remotely. Provider staff must be proficient in the setup of basic hardware and software to be able to deliver the startup service effectively and meet the service outcomes as previously noted. OOD staff must verify startup has been added to the provider search as a service prior to authorizing.
When you go to your provider management portal or PMP, on the screen right now, you will see an example of what it looks like. On the bottom left-hand corner under My Application Change Request is where you would click to add startup services.
Comparable benefits. When possible, we encourage participants to utilize available resources including family, friends, and customer lines such as Apple Support, Phone Hotline, or Genius Bar for hardware and software assistance. When those are not available, the startup service is an appropriate option for participants. Participants who are comfortable and able to access available online tutorials should do so, though this is different from the startup service and would not be an authorized billable service. Startup is a real-time direct service in which a provider assists an individual in becoming familiar with technology, allowing them to engage in remote services. This would be an in-person service, typically at a provider's office or other secure location in the community, such as a reserved library room. Referrals to available online tutorials or pay learning systems is not a direct billable service.
For this slide, we're going to look at different examples. For the first example, we have Susie, who is 55 years old and will be participating in remote tutoring services from the provider's addendum services. She needs assistance setting up her laptop prior to the service and ensuring she can access Zoom, as well as understanding how to utilize the camera and headphones. Startup may be used to help Susie set up her laptop and software to be able to access remote services, as well as to ensure she understands how to operate the camera and headphones. Our next example is Tony, and he is receiving job development services and will be participating in remote interviews. He has never utilized remote services, and he is not sure how to set up, utilize, or communicate with employers. Startup may be used to help Tony set up equipment and software, as well as go over basic etiquette and security issues. Our third example is where a vocational rehabilitation counselor is meeting with Emily to provide startup. As they are meeting, the vocational rehab counselor recognizes that Emily has extensive technology needs due to a vision impairment. The counselor determines that Rehabilitation Technology is a more appropriate service than startup. For our fourth example, the counselor will be meeting with an application intake with Mason, whom they need to meet with remotely. In this case, OOD would not utilize startup as the service is not available to participants in application status. For our fifth and final example, Tom is a current OOD participant who is completing in-person career exploration and may be attending vocational training in the next 6 months. Startup would not be appropriate, as startup would need to be used in conjunction with a current service and is not intended to be used for potential services in the future.
So what are the next steps? Providers who qualify for and would like to offer this service may request the service within the Provider Management Program, or the PMP. If there are any questions regarding this new service, please submit any questions you may have to PCMU at pcmu@od.ohio.gov. After providers are approved within the PMP to offer this service, it will be reflected in the OOD provider search. This service may not be authorized until the service shows up in the provider's menu of services as listed in the OOD provider search.
Thank you so much for listening to this presentation about our new startup service. If you have additional questions, please contact the Provider and Contract Management Unit using the contacts and numbers on this screen, or you can also email pcmu@ood.ohio.gov.
The startup service will benefit individuals with disabilities throughout Ohio to access important services to find and maintain employment. Interested and qualified providers may sign up in the PMP today.